Hello guys, welcome back everyone. Today's video is about one of the very important topics in nursing, which is hyperkalemia. Hyperkalemia, hyper means a lot, and kalemia means one of the most important electrolytes found in our body, which is K plus potassium, which is found mostly inside of our cells, which is intracellular. So, we're gonna know what causes it and what are the main signs and symptoms. So let's get started. So, to understand better, we should understand what's the main function of potassium. And it's very simple. Potassium is super duper important for muscle contraction. Now, if you think about muscle, you always think about your body muscles, right? But one of the most important muscles in your body is actually the heart. The heart is a muscle. And so potassium helps contract the heart efficiently. So if there is any imbalance in the electrolytes levels of potassium, specifically we're talking about, it's gonna be bad for the body. It's gonna alter all the stuff that is going in the body and bring problems. So the normal range of potassium in our body is 3.5 to 5. That's the normal range. Now when we say hyperkalemia, like I said, it's too much potassium. That means more than 5. Anything more than 5 of potassium levels is bad and should be intervened very quickly. So, what causes this hyperkalemia? So, a good way to remember some of the most important causes and the common ones is this mnemonic called machine. And here I wrote the mnemonic and what does each letter mean. So M will be for medications. Medications can have an effect on electrolytes. Now, for example, the medication spironolactone is a diuretic, and it is a potassium sparing diuretic. Very important. So potassium sparing means it's not gonna excrete the potassium. The potassium is gonna stay in the body. So if you're using that diuretic, you're more prone to not excrete those potassiums, right? That's what the medication is doing. So you're going to have an increase in potassium. Another one is acidosis. And this is because potassium and sodium play they're a very important pump, and so this pump of sodium and potassium balances acid and bases in the body. It helps to maintain the pH of the body. Now, if there's acidosis, that means there is an difference in this potassium and sodium pump. So that's gonna alter it. Cellular destruction for letter C. This is when we get burns or traumas. Remember I said the potassium is found in the cell in large amounts. So in burns and traumas, when cells are destroyed, the cell will burst the contents, including and releasing large amounts of potassium in the body. H will stand for hypoaldosterone. Hypo means too little of aldosterone. This is mainly your Addison disease. Addison disease is less amount of aldosterone. Now, what does aldosterone do? So basically, this is a hormone that hates potassium. So when we have a large amount of aldosterone, it will excrete the potassium because it just hates it. But if we have little, in this case hypo, little, that means there's not enough potassium being excreted, and instead it's being in the body. So that's one of the causes that happen for hyperkalemia. I will stand for increase of potassium intake. Mainly it's due to any IVs running, any medications as we talked. Diet too, it plays a little role, but it does also play a role, right? For example, bananas, dry fruits, green stuff, those are high in potassium. N will stand for nephrons. Now, nephrons is when it's ruptured, for example, in kidney failure. Kidney failure, you can't excrete enough potassium, right? You need the kidney to be working fully and perfectly for the potassium to be excreted. So E again also ties back into the kidney, which is excretion problems. So these are your dialysis patients. They do have this kidney problems, and renally impaired patients, they can't properly be excrete potassium. So kidney does play a major role. So now we're going to see some signs and symptoms. We're going to go through the major body systems and what does it do. So obviously, to start first, we have to talk about our very important muscle, the heart. Now the heart will be tight and contracted. So when we talk about hyperkalemia, just think about two words: tight and contracted. Everything will be tight and contracted. You will see in the other slides that how does it tie on the fact that hyperkalemia, it will show tight and contracted symptoms. So for your heart will be working a lot, right? It's going to be tight. So there will be an irregular heartbeat in your vital signs. It's trying to pump nicely, but it's too tight. So there will be hypertension. Your blood pressure will be increased. And because your hypertension is up, your heart rate will go down. Heart rate, because it's trying to compensate whatever is going through the blood pressure. Now, when we talk about EKGs, there is going to be a change, which you will see tall T waves. So this is your P, Q, R, S, and this is the T, right? So do you see how big it is? The T wave, that's the difference when you have hyperkalemia, because usually it should be something like this. Now we come to respiratory. Again, remember, tight and contracted. So if your lungs are tight and contracted, especially your diaphragm, it's contracted, it's not going to expand or, inhale or exhale perfectly. So you will go through respiratory failure, which is a big no. Urinary, like we said, kidneys play a major role in excretion of potassium, and so tight and contracted urinary system, that means that your bladder is suffering, it's not working well. So there will be a less of urine output because of, like we said, renal failure. So we should monitor urine or intake and output. GI system. Again, there's contraction, there's tightness, but there's also going to be action in the GI system, right? There's a lot of motility. You will be able to hear hyperactive bowel sounds. So a lot of sounds in bowel sounds. This is because your GI system is acting, right? It's moving, and this will show the major symptom also of diarrhea when you're with hyperkalemia. So that's one of the major symptoms. Neurological, there is again tight, contracted, remember, and the major symptom in neuro will be that the patient will be confused, right? They will be confused. What is going on? They're not 8 times O times 4. And lastly, we're going to talk about neuromuscular. Again, muscles are the major role of potassium. it's tight and contracted, so you will find muscle weakness, you'll find cramping, tingling, and numbness. So these are the major signs and symptoms you should know that are presented with hyperkalemia. Well guys, I hope you enjoyed this video. Hypokalemia will be next. I will have the same formatting and everything. So don't forget to subscribe for more, like, and